This is the Emergency Medical Minute, sponsored by Health One.
I do, y'all. Hear me? Okay. I'm in my low chair. So mine are always quick. I only have so much knowledge I can remember. Knee dislocations, just something that we probably are going to see, if ever, in trauma. And they're usually a high mechanism injury. And the tricky thing is, like, what can happen is, it usually happens in a car accident, like a knee into the dashboard. It dislocates posteriorly and then relocates, and they might come in complaining a little bit of pain, but anatomically everything looks roughly right. So it's important, if the mechanism sounds like it, to evaluate the knee, evaluate the lower leg, do a vascular assessment, because that's where the big damage is going to be done. They're almost half of them, a posterior dislocation that relocates, are associated with a popliteal injury. And obviously that's missed. You could have ischemia to the leg and some significant complications. So it's always good to think about that, to do an assessment. Obviously, if there's going to be a pulse deficit, that's going to tune you in pretty quickly. You'll get a vascular surgeon involved. But the softer ones are going to typically be evaluated like a CTA or getting ABIs. And that's a good way to kind of rule out vascular injury. ABIs, comparing the upper extremity blood pressure to the lower. If the ratio is greater than 0.9, is actually very favorable. It pretty much argues against a vascular injury. Anything below is pretty sensitive in detecting it and would require like a CTA or a vascular surgeon. So just something to keep in mind that can be easily missed with a lot of devastating complications, but can be pretty easily picked up if you tuned into it. So that's it.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.